Spiro Plastic Surgery people out there. That's our followers, our listeners, watchers, to episode 8 of Artist in the OR. I'm Dr. Scott Spiro. Gina's again our moderator. Thanks, Gina, for being our moderator.
Thanks for
our
having
expert stellar nurse here at Spiro Plastic Surgery. And today we're going to hit on another topic. Hot topic out there. Mommy makeover.
Mommy makeover.
Cringing, not on mommy makeover, but by the name.
Yeah.
By mommy makeover, because it's not really not about mommies anymore, right?
No. Yeah.
So Gina.
So before we kind of get into details, why is it so important? And again, what you just said, it's not just about moms, okay? So it's people, pregnancy changes, weight loss changes. So why is this so important? I know we're seeing it so often. It's one of my favorite ones to go into because I just love going, head to toe.
Great
but
topic.
yeah.
Great topic.
Yeah.
So again, yes, it sort of came about that it was called Mommy Makeover, and we love the word Mommy Makeover. We're kidding somewhat.
Yeah.
But we don't want to exclude the people who are having the same exact surgery who have undergone some significant or dramatic weight loss, right?
Yeah.
So it's sort of all encompassing of that. And really what the term Mommy Makeover is, because we haven't effectively come up with a better all-encompassing term. It's a combination, just the connotation is it's a combination of surgeries that are done together that will improve and restore somebody's body back to either pre-pregnancy body, better than ever body, and same for people, women and men, who have had significant weight loss.
Yeah. So you've been performing body contouring for nearly 3 decades. So you can share with us maybe a little bit of your background, your experience in the field, because I know better than anybody, you go about this head on, and it's some of the best results I've ever seen.
Yeah, so to me, this is really where I can use my artistic background. And again, all you podcast watchers, listeners can't see it, but if you're watching this podcast, you can see one of my copies of my paintings in the background. So I've been an artist my whole life. Plastic surgeries, everything that I've ever done, trained with the world's greatest plastic surgeon living in the 20th century, and have been sort of championing that banner for 29 years in practice. The culmination of being able to put art and skill together, this is the ultimate. To be able to look at a body, kind of like a sculptor would take a big block of granite or marble, and patients are like, oh my God, there's no hope for me. Look at what's happened to my body. And I look at that and I'm like, I see the final outcome in all this. Just like a sculptor sees a block of granite or marble and sees the final outcome before they start. Yeah. So that to me is, why I love this.
Yeah. So for some people who may not know, kind of to start, how do you define a mommy makeover? Many people think, again, it's only a procedure for women who've had children. So can you kind of explain, even after massive weight loss and stuff like that, kind of what is it?
Sure. So, male or female.
Yes.
So massive weight loss or the changes that happen with pregnancy, breasts deflate, they sag, bodies lose elasticity. In particularly women who've had kids, part of the mommy makeover, dictum is they've lost abdominal wall tone. And a lot of them will say, I'm unhappy in my body. I'm embarrassed by my figure. I'm very self-conscious about it. So this is part of restorative healing, both in the physical and mindfulness part of it.
Yeah.
So yeah, it's a combination often of breast surgery, body contouring, tummy tuck, liposuction, fat grafting, 3-dimensional. So I'm a 3-dimensional person. I'm looking at the whole body is 3D. It's not plain or 2-dimensional. I think that's also what sets us apart, is that I'm willing, I look at the whole body. I'm up for the challenge. It's not complex surgery for me. And we'll get more involved in that as we talk.
And being realistic.
Realistic,
too.
yeah, you got to be realistic.
Right.
So.
So postpartum anatomy. So kind of walk us through the key anatomical changes, kind of what happens after pregnancy and weight loss. I know you kind of hit on that, but you know, everything drops, but it's kind of more than that.
Yeah.
And it goes deeper again into the anatomy. Some people say, I want a little tuck or just a little this but you know, it's more than that.
So I get it. A lot of people come in here hoping that there are simple solutions.
Yeah.
And sometimes there
are, right.
And if there's a simple way to solve something, I'm the first one to want to offer that to somebody.
Right.
But, you know, the facts are that skin changes.
Yeah.
It loses elasticity. These are not liposuction cases really anymore in Mommy Makeover. Ancillary added to it maybe, but, you know, tummy tuck, fixing a diastasis. It's not just, I lost volume on my breast, I'll put an implant in. It usually requires a breast lift with it. Arms, look at my arms. I lost 80 or 100 pounds. Again, not necessarily Mommy Makeover, but I've lost 100 pounds and look at my arms. Well, I look at the arms, but I say, well, what about the side of the torso too? Oh yeah, that really bothers me as well. I hate that. And so I know, and I just try to come up with a plan. Here it's, as Gina knows, and our former patients, present patients knows, it's about safety first. I want to usher somebody into safe realm. So how do we do that? Which may mean in some people it's maybe more than one surgery. Safety matters. It's why I do it at the hospital, but we'll talk more about that too.
So walk us through kind of, you know, talked about a lot, rectus diastasis, kind of what is it? How does it impact both aesthetics, function? When does it need to be repaired? When does it not? For our listeners.
So for a lot of patients, they don't realize that their back problems, their neck issues, headaches, bladder dysfunction, all can be traced back to some commonality. Diastasis, separation of muscles. And I kind of like to define it. I've created this concept that I teach my residents, and I teach residents as I'm doing the surgery for them to learn. My thinking is, well, there's an anatomic and a physiologic.
Right.
So maybe the separation of muscles may be only 5 centimeters, but it's affecting maybe a foot of their abdomen. It's making them apparent weakness be even more. So for me, the core principle in this, in tummy tuck surgery, is about restoring equalization of tone across the fascia. I call it RETAF, R-E-T-A-F, but that's really the hallmark here. So I kind of pride myself. I want to make them look really aesthetic, really beautiful bodies, but really what I am also after, I'm priding myself on, I want there to be a dramatic functional improvement. I want them to get back in the gym. I want them to kick butt. I want them to come back and say, hey, I won my fitness challenge class. Other people are jealous of me. I'm stronger than I've ever been. So that's, you know, it's all of that.
It's all of that. Yeah. So kind of piggybacking off of that, how do you determine whether, because you know this, we hate this word, but someone needs a mini or a full tummy tuck, diastasis repair, kind of how do you, you know, do that? How do you think about the incision placement, scar optimization? What kind of goes through your head for that?
Okay, great. So, you know, mini, as we refer to here, often means mini thinking or mini outcomes. So again, no filter. I look at somebody and I tell them these are the issues and these are the solutions. There's often options. It's not just one thing.
Right.
And if somebody's goal is less surgery, I'm going to say, okay, this is what you'll get from less. They have to have it's got to be aligned with the expectations. So if somebody's expectation is they want to look like they looked when they were 18, mini anything after kids or weight loss, not going to solve it.
Yeah.
So, you know, we got to come up with a plan. But yeah, we're anatomically based. So we like to say mini is really infra-umbilical, below the belly button, skin only, tummy tuck. Now that can be combined with lipo if it's beneficial to somebody.
Yeah.
So we like the anatomic words. We're sort of competing with social media
Yeah,
where
right.
there's no reference to anatomy or physiology.
Yeah.
It's some new phraseology every day. But when they're here, we bring it back to the real world of surgery where mini is skin only, no abdominal wall, below the belly button, infraumbilical, tummy tuck. And that could be a simple procedure where they're in and out of the hospital a couple
Yeah.
hours and they're driving a car in a couple of days and they're back in the gym in a quicker time and back at work versus, doing everything. So,
Yeah.
yeah.
So liposuction, I know you touched on it a little bit, often pairs with the tummy tuck. So how do
Yep.
you decide when it's lipo alone versus lipo with the tummy tuck? And
Yeah, great. And that's like the most
yeah, the
frequently
most
asked.
frequent, yeah.
And also the most understood. So patients will come in and say, "Oh, well, I saw another surgeon or I saw this girl talk about it on TikTok." And I said, "Whoa, time out. Let's talk about the reality here."
Yeah.
In my type of very thorough, complete abdominoplasty tummy tuck where I'm doing abdominal wall work, you cannot do full 360 lipo at the same time. Now, I do 360 lipo, that's all the way around the body, and that I combine with the mini tummy tuck we talked about. But if somebody needs a full tummy tuck, but they also may need lipo of their abdomen, then that has to be staged. We do the tummy tuck first, maybe with hip and flank lipo at that time. Or maybe we will say, no, you're going to do the tummy tuck now. Maybe you're going to do it with the breast surgery you want to do. But we're going to save that 360 lipo maneuver for your next phase of this because that's what would impart the greatest outcome. So,
Right.
again, unfiltered, I'm looking at somebody in an instant. I could look and say, hey, this is how you're going to get your best outcome. And what do you want to do to achieve that? And or if there's other options, they may be compromises. As long as somebody has aligned, realistic expectations, I'm fine with
Yeah.
that.
So on the breast side of things, because mommy makeover breast and tummy, that's what
Yep.
sometimes it is. How do you decide between a lift, an implant, fat grafting? Fat grafting has become very popular. We hear it all the time.
Yeah.
So how do you kind of determine for somebody what they need?
Well, first I look at somebody in patients who've had significant weight loss, where skin has failed, it sags, it's lost elasticity, there's a lot of stretch marks. Those patients are not really lipo patients anymore because there's no ability for the skin to retract back. So that's not the main issue here. So it's about excisional procedures, getting rid of excesses, hiding scars as best as possible, using that combination in females with an implant. But in males, major body weight loss, they have failing chest too. So they may have sag and they need the male version, the gynecomastia surgery
Yeah.
with it. So fat grafting, if they have fat in their breast, fat can go in. If their breast is pure gland, fat's not going to be a great solution for them. Commingling implants and fat, sure, but at stage procedures. So there is a lot that goes into that. I value and I tell patients also, we're going to do everything we can to maintain nipple and areola function, sensation. Breast lifts require scars. And I say, are we after the best aesthetic breast outcome? Then this is the procedure you need.
Yeah.
It's often, again, as a patient, you would envision, I don't want any scars. Okay, but how are we going to achieve this surgery,
Yeah,
right? And I want the simplest thing. So that's everybody comes in here, or most people come in here hoping that. But the reality is that everybody's different, and I'm going to pose all the different options to them.
Yeah. So if we're shooting towards patients that are, mothers, have children, how long should patients wait after pregnancy or breastfeeding before, considering the surgery? How does future family planning factor into this? Because these are all points people always come in asking.
They always come in and ask.
Yeah.
First of all, that's a great point. I'm going to say this about it, that in the breast lift and implant group, or just the breast lift group, I do everything I can to preserve nipple and areola functionality and sensation. So if they're going to get pregnant again and attempt to breastfeed, I'm going to do the procedure that sets patients up for the greatest likelihood of achieving that. Now, is it a great idea to be doing this surgery in somebody who, is going to have kids again? Not that there's anything wrong with that, but I usually will say to them, and you've heard me say this many times, I say, okay, we've got your crystal ball here.
Yeah.
Are you planning any additional pregnancies in a certain time frame? Well, I'm not really sure. I say, okay, then we kind of want to do what's important for you now. Because if you're not sure, or even if your crystal ball says, okay, that might be 10 or 15 years, 12 years down the road, they may have had massive weight loss, they're not prepared to have kids right now, but that's in the future for them. I say, look, let's do what's important for you right now. Because if we don't, unknown future, and it's down the road, let's not wait for an unknown future to develop.
Right.
But in somebody who says, oh yeah, I have 2 kids, and as a matter of fact, we're going to have another kid in another year, then I would say, let's hold off.
Yeah.
Let's hold off. I don't want to do all this great surgery and have somebody feel like they have to come back here in 2 years and do it all over again. Now, in terms of timing, we don't do surgery on somebody actively breastfeeding because tissues are engorged and there's a greater risk of infection with breast surgery and bleeding. So we usually like patients to have stopped breastfeeding for, a reasonably significant period of time that their breast deflates, decompresses, is back down to where the tissues can be handled better. That's usually never less than 3 months after they've stopped breastfeeding. So, and in terms of, timing after pregnancy, same thing. It's not like I just delivered a baby yesterday and I look terrible.
Let's get on it.
I want my surgery, next month.
Yeah.
We usually got to give people a physiological, appropriate time to recover from passing.
So that's
again 3 months.
That's minimum. That's all kind of before. So now after recovery timeline, what's the roadmap? From even the first 2 weeks to, the first year milestones.
So
this is big stuff.
Surgery's big. This is big. Sir, Mommy Makeover, or we'll call it all-encompassing. Maybe we should name it all-encompassing restorative body contouring.
Yeah.
During this podcast, I just came up with that. Don't use my line.
Yeah.
So, there's a recovery involved, and it's 3 months. It's 6 weeks before they can re-engage in fitness activities. It's 12 weeks until they can do isolated, hard-on core stuff. It's a couple of weeks minimum till they can get back to work. It's maybe 3 to 4 weeks until they can sort of take over the lead in running the household again, like no stuff around the house. So that's realism. So somebody who comes in and says, I was hoping I'd get back to work in 3 days, and I don't want to put my spouse out, and I don't want people to feel like I can't do it. You just can't. And at the beginning, before you do it, it seems like a really long time. But when you're engaged in it and you're doing it, all of a sudden, that time does pass pretty quickly.
Yeah.
Now, longest term, if we focus on abdomen as part of Mommy Makeover, initially, breast is the rate limiting issue. Breast is delicate, heals really slowly, and that's kind of the rate limiting issue for patients to get back to things. So that's like a solid month for breasts are like the tortoise and the hare. It's the tortoise. It's the slowest thing to initially heal. Even though there's no pain, they feel fine, they look amazing, but it is slow. Tummies, on the other hand, heal initially a little bit more quickly, except for abdominal wall. So the rate-limiting long-term issue is they're able to get back to all fitness-related breast things in 4 to 6 weeks, but for abdomen, it's 12 weeks before they can get back to core stuff. And beyond that, it's really, now they're looking at, in order to build abs, and I give the analogy, I say, hey, you didn't have kids, you didn't work out, I'm your trainer, you say to me, I want to be killing it in the gym and have amazing abs. we could do that in a month, right? And I'm like, wait a minute. I always hear the famous thing, abs are made in the kitchen, not in the gym, right? So it's a lot of things involved in that. But after you repair and restore abdominal wall, I tell patients this is a 1-year proposition. I'm going to get you hitting the ground running, but don't get discouraged and understand, even if you didn't have surgery, getting your core and abs looking dynamite is the longest of any body part. You can get your shoulders, your arms, your thighs, quicker, chest, faster than abs and core. So they got to understand it's a 6 to 12 month, process.
Yeah. And I think patients appreciate too, we see them so often.
Yeah.
We're always there, we call them often, and we kind of just, we don't just kick them out the door the day after.
Well, that's it. This is full, we're invested full on in this.
Right.
It's not like, okay, come in, I evaluate you, okay, sign up for surgery.
Yeah.
Okay, you have the surgery, and we see you once, and then you're on your own. We're like, I tell patients, you're going to get so sick of us.
Yeah, right.
And then, eventually you'll graduate and you won't have to come back anymore. But yes, we see patients twice minimum before. We see them weekly for the first 3 to 4 weeks.
Yeah.
Then a hallmark visit, check their core strength at 12 weeks, scar check visits with you or our nurse practitioner who does lasers. So it's an all-encompassing thing.
Yeah. So other than, recovery and what goes on after, before, what factors influence the cost of mommy makeover? Why do prices kind of vary so much between surgeons?
Great question.
Yeah.
So, mini versus full, big difference in price.
Right.
Length of surgery, body lift.
Yeah.
Body lifts, slang means all around. So it's not just tummy tuck. It's flank, hip, lateral thigh, and buttock lift. Maybe with lipo, maybe with fat grafting of buttock, maybe with breast augmentation, maybe with breast lift, maybe with breast lift and implants. Every one of those additive things are going to change the surgery. But here's another important point patients have to know about us. I don't do this. It's not some sketchy office OR.
Yeah.
You come in, we compromise safety, and there's been a lot of high profile bad things that have happened to really good people, well-known people out there in music business and politics who've had a family member have a really terrible problem. It's because they compromised on safety. So there's no compromise on safety. We're doing the surgery in the hospital, top-notch anesthesia, top-notch team. If it's involved with full tummy tuck, they're staying overnight. Mm-hmm. We are all over them. We are giving them state-of-the-art everything, things that couldn't be delivered in hey, come in, I'll do your surgery in my office-based OR. I'll send you out to my private clinic where a nurse is going to come visit you in a hotel room. So maybe those surgical, those surgeons can't provide what we can provide here. And maybe that's why they never heard of it. But rest assured, we're doing everything behind the scenes to give them the greatest opportunity for a successful outcome. Yeah. All that factors into costs.
Right.
Yeah, the number of visits they have here, the attention to detail, the intensity in which they're managed. So those are all cost-related things.
Yeah. So frequently asked questions, rapid fire. I think I love rapid fire.
That means we're about to end.
So let's go over some stuff. How long is surgery? Obviously going to depend, but
depends on what we're doing. Yeah. So look, I like to say, my residents will tell me, wow, you're the fastest at doing this, but I'm not sloppy.
Yeah.
So things take time, right? So everything's additive. 2 hours for this part, an hour for this, 2 hours for this, an hour and a half for this. And I'm not cavalier. I don't compromise safety, but I also put people in an environment where they can accomplish more things together at once. I certainly am capable of doing it. you know. So surgeries could be anywhere from mommy makeovers could be a 2 to 3 hour procedure. It could be an 8-hour combination. 8 hours. Oh
I
my
know.
God. But if you're doing it with an anesthesiologist who's with you all the time, and you're working in lockstep with an OR team who's with me every single day, and we all know the game plan, we can deliver these safe outcomes to people.
Yeah.
So the length of time varies on the combo or the procedures.
Right.
Remember, it's not how short your surgery
Yes.
was. You don't wear a sign that says, oh, my surgery was an hour and a half.
Yeah.
I could do any surgery as efficiently, quickly, or quicker than anybody. But nobody's wearing a sign that says, oh, I did a mini because my mini tummy tuck was an hour versus my complete tummy tuck was 2 hours and 38 minutes. You wouldn't know, you're asleep. And you're not going to wear the sign you wear is your outcome.
Right.
That's all that matters.
Yeah.
Okay.
All right. So, the word we hate to hear, but how painful is it?
It's not a great way to end the podcast talking about pain, but it's important to talk about, right? So we don't want people in pain. We don't want you in pain. I won't want my next patient in pain. But surgeries are surgeries. Now, here's what we do. We work with very sophisticated anesthesiologists who mitigate pain by providing really high-level, state-of-the-art pain blocks for people. I have a way of doing surgery. Patients say, wow, I can't believe I wasn't really in pain. One of the secrets, tummy tuck patients, we make you wear a binder for a week leading up to surgery. Seems so inconvenient and annoying. It ends up mitigating pain because their brain sort of gets used to the pressure sensation.
Right.
So we have tricks. Things can be uncomfortable. We kind of limit the amount of pain. Patients are often amazed at how little pain overall.
Yeah. Scars.
Well, I mean, excisions lead to scars. Again, I have a knack of putting it in body contour appropriate ways so they're less noticeable, hidden better. We treat people with lasers, maybe Botox and scars. The days of injecting with steroids are out.
Yeah.
So,
Can you breastfeed afterwards?
well, we hit on that. You could, but again, if you're doing a mommy makeover, we'd kind of like you to be finished having kids.
Yeah.
So.
All right, closing. If you could leave patients kind of one message about mommy makeovers, timing, safety, expectations.
Yeah.
Your tagline, what would it be? Yeah.
Okay. Well, remember, it's surgeon by trade, artist at heart. I'm looking at all of that. I can deliver expertly on the technical aspects of the surgery, but also know what the artistry of the female aesthetic body is. Knowing the ideal, beautiful, normal, and being able to deliver it in a safe environment, because that's our number one thing. I think that's what I want people to leave here knowing the most.
That's my favorite point too.
Yeah, great. Again,
All right.
thanks for joining us on episode 8. Mommy Makeover, but not Mommy Makeover. I can't even remember what we called it at the beginning of this podcast.
Yeah.
But it's all-encompassing restoration of the body after having kids and or dramatic weight loss. See you for episode 9. This is Dr. Spiro and Gina saying thanks for joining us.
Bye, guys.